Welcome to Climate Change and Health in Small Island Developing States, focus on the Caribbean. If you require translation into Spanish or French, please use the link posted in the chat and choose your desired language at the bottom of the Zoom screen. You should continue to keep this browser open as well to utilize the chat and Q&A features. Please be sure to scroll down and mute the video. Please use the Q&A feature to submit any questions for the speakers. This session is being recorded. Thank you.
Good morning, buenos dias, bonjour. My name is James Hospedales, founder of the Earth Medic and Earth Nurse Foundation for Planetary Health. We are very pleased to be one of the co-organizers of this conference, along with many key partners, such as Yale University and Emory University, University West Indies, Pan American Health Organization, who have joined forces to address the climate and health crisis in small island and low-lying developing states, or SIDS for short, in this conference with a special focus on the Caribbean. A warm welcome to those of you joining us at this time. We just heard from the opening ceremony on why climate change and health is so important and to receive the big directives for our conference. Climate and economy has been relatively well explored, but it is only more recently that the different dimensions of the climate and health crisis are being realized. Today is my birthday, and I cannot think of a better way to celebrate than to have the conference opening on this day. At this time, it gives me great pleasure to introduce Professor Michael Taylor and to moderate this keynote session. It was 5 years ago, in October 2016, at the first International Conference on Climate Change in the Caribbean in Port of Spain, Trinidad, organized by the Caribbean Community Center on Climate Change, or 5Cs, that I heard the work of Professor Michael Taylor's group in downsizing the science of climate change to the Caribbean region. Colleagues and friends, I have to tell you that it was an epiphany moment for me. I suddenly realized that most of the problems on which I had worked in my professional career, infectious diseases, epidemics and pandemics, non-communicable diseases or NCDs, were in fact related to climate change and destruction of the environment. At that conference in 2016, I heard that the Caribbean was in for hotter, drier weather overall, more monster hurricanes, and inundation of rain and flooding. Floods, which increased the risk of several diseases, waterborne diseases, and conditions like leptospirosis. And if we look around and open our eyes, these are all unfolding in the region and beyond. The implications for health and well-being are profound, as all of us who live in small island states know too well. Now, when I heard the science downsized to the Caribbean, I thought, oh my God, doctors and nurses and health professionals need to know this. And that moment 5 years ago was a significant milestone for me in the steps towards launching the Earth Medic and Earth Nurse Foundation last year to mobilize health professionals to wake up to this threat, to address the health and climate crisis beginning in the Caribbean. Now, I want to share something else with you, something personal. Today is not only my birthday, today marks 2 weeks since I was discharged from hospital after a life-threatening bout of leptospirosis, likely acquired in our home garden in Trinidad. It has been an unprecedented wet year in Trinidad and Tobago, notwithstanding the heat waves that the Met Office was talking about last week. I foolishly mowed a soggy wet lawn barefooted, and that was my likely exposure. But I'm pleased to report that I'm well on the road to full recovery, and my family bought me waterproof gardening shoes for my birthday. Now, allow me to introduce our keynote speaker who we're all anxious to hear. Michael Taylor is Professor of Climate Science and Dean of the Faculty of Science and Technology at the Mona campus of the University of the West Indies. Professor Taylor is co-director of the Climate Studies Group in Mona, and he was coordinating lead author for Chapter 3 of the special report on 1.5 degrees of the Intergovernmental Panel on Climate Change and the 2019 Ansa McCall Caribbean Laureate for Excellence in Science. Professor Taylor, over to you.
Thank you very much, James. And first of all, happy birthday. Let me wish you that happy birthday. And it is very good to know that you are in recovery mode. Let me also thank you and certainly thank all the persons who were responsible for putting together this conference. I really appreciate the invitation, and it is really good to be here. Today, what I'm going to talk to you about is, as you have heard, downsizing climate science to the Caribbean. In fact, I've added a little bit what to do. And really, I'm a Caribbean climate scientist, as you have heard, and I'm going to talk about downsizing climate science information for the Caribbean, looking a little bit on what we should do and talking a little bit about some implications for health. The truth is that there is a lot of climate science information out there. So the IPCC most recently put out the physical science basis, the report of Working Group 1. And many of you will know that it is code red, as has been described, for climate action. But that report was the next in line for a cycle of reports, which included the special report on 1.5, climate change on land, and looking on oceans. Last year as well, within the Caribbean, we launched what is called the State of the Caribbean Climate Report. And that too is a formidable report done by 3 Caribbean institutes that provides a lot of climate science information. And so when you have all this climate science information out there, sometimes it's hard to distill what we should take away for the Caribbean region. In this very, very quick talk, all that I want to do is simply distill and downscale some of the climate science information for the Caribbean context, and really explore if there are some simple takeaways with respect to what we should do in the region when it comes to climate change from all this climate science information that exists. It's difficult to take all the climate science information and distill it. But what I'm going to try to do is just simply talk about 3 things that the climate science is telling us that we have to do when it comes to the Caribbean and small islands. So try to distill, trying to downscale climate science information into perhaps 3 things that I think are important for us to do when it comes to climate change as revealed from climate science. So let's go. 3 things that I think we need to do. The first thing I think the science is telling us is a simple message. When it comes to climate change in the Caribbean, we have to acknowledge it as a present concern. Acknowledge climate change as a present concern. The truth is, we can pull statements like this from the State of the Caribbean Climate, which sums up what I am saying. The very climate that has for decades underpinned the economies of many Caribbean territories is now proving to be their greatest area of vulnerability. But let's explore this just a little bit more. What do I mean? Acknowledge it as a present concern. Well, if I were to pull on the science that has been done with respect to climate for the Caribbean region, some things emerge. First of all, it emerges that the Caribbean region is hotter. It's getting hotter. And I pull on this diagram from the Caribbean Institute for Meteorology and Hydrology, which shows warm days in a year as we have gone from 1981 down to the middle of so 2011, 2012. And what you will notice is that the reds get progressively dark as you go to the right, and they fill up more of the vertical space. What this is saying is that, simply put, we have been having an increase in the number of warm days in a year in the Caribbean region. And this is for a record in the Lesser Antilles going back to the 1980s. But this is true right across the Caribbean. Right across the Caribbean, temperature indices are all increasing. And it doesn't matter what the index you are taking, whether it's the frequency of warm days, the frequency of warm nights, the hottest days and nights. In fact, the only decreases you will see would be in the frequency of cold days, cold nights, or the warming of the coldest, or frequency of the coldest days and the coldest nights, sorry. So temperature indices across the Caribbean are all increasing around this mean 1 degree increase that the Caribbean has seen for the last century. If we want to quantify, 23 more hot days and nights since the 1950s. And that translates into summer seeming to start earlier and last longer. And the warming is across both land and ocean. But that's not the only thing the science is telling us. It's not only telling us that it's hotter, but the science is also telling us that our rainfall in the Caribbean is becoming way more variable. And so if you look on the top diagram, which is Caribbean rainfall, you'll notice that 1 year that blue line is up and the next year it is down. And it keeps swinging between the ups and the downs. And what we realize is that there is this increased variability when it comes on to Caribbean rainfall. But not only that, I think many people in the Caribbean can relate to the fact that the nature of how rain it falls is also changing. And that's why when you look on intense rainfall, all those triangles are up across the Caribbean region. Because how rain has been falling is that we get these consecutive dry days, and then when it rains, it really rains. And so the science is telling us that it's hotter in the Caribbean, and certainly our rain is way more variable. The science is also telling us that our sea levels are much higher. And illustrated by this diagram of Negril in Jamaica. And what you can see is the shifting of the tree line, or the shifting of the base of the beach, or the loss of shoreline. Sea levels in the Caribbean are rising at about the rate of 1.7 millimeters per year in the long term. Or if you take in the more recent times, about double that rate, about 3.5 millimeters per year. And then if I were to choose one more indication from the science of what's happening in the Caribbean, it's more extremes. Now we can talk about the slow onset extremes like drought. And you would see that in the Caribbean, severe drought, in the last decade alone, we have had 2 major region-wide multi-year droughts. The last one being 2013 to 2016, which was most severe. And so droughts, those long-term onset extremes, there's evidence of more of them in the Caribbean with a climate change signal. And then if we were to talk about Atlantic hurricanes or Atlantic storms, named storms, hurricanes, and major hurricanes, you can see an imprint there as well, as we look on the seemingly increase in more intense hurricanes. And very interestingly, the IPCC's latest report provides one very important statement with respect to extremes. It says that the evidence of observed changes in extremes, such as those that I have talked about, you can find the human influence in them. That has certainly strengthened since their last cycle of reports. Put all of that together, and what the science is saying is that, listen, it's hotter in the Caribbean, the rain is more variable, the nature of how rain falls, the sea levels are higher, we see more extremes, but we're not seeing one or the other. We're seeing them in a compound way. And so the science is saying, listen, Caribbean climate is already changing in multiple ways, such that the climate is just not behaving as it used to. So for us as Caribbean people, we see the climate as unfamiliar. And the science is saying we need to acknowledge this. Climate is a present concern. But let's push this a little bit further. Why do we need to acknowledge it? In truth, the Caribbean depends on the familiarity of climate patterns for development and for quality and standard of life. Can I make the point very quickly? Climate is so much an integral part of Caribbean existence. It's an integral part of who we are. Why? Because we embed the climate patterns in how we live. So we know when it is supposed to be wet and dry, and we know when the temperatures are supposed to be highest, and we pattern our lives around them. We plant around them, we reap around them, sporting events, cycles of of holidays and when children are in school, we pattern our lives around this embedded climate. But add to that much of the Caribbean are small islands with very narrow coastal plains and very steep interior, mountains or hills. And so life either takes place on the narrow coastal plains, which are very limited, or steep slopes. You cannot escape them when the climate is going to change and it brings an impact on where we must live. And then, of course, our economic well-being and our quality of life is extremely wrapped up in climate. Think of what we have for economy: agriculture, tourism, fisheries, mining, or think of our health and well-being, which you are discussing in this conference, or think of our the sectors that enable, are critical for our livelihood: water and energy. All are intimately bound up with climate. The truth is, when you put all of this together, climate becomes an integral part of Caribbean existence. So when the climate begins to become unfamiliar, the climate is causing problems for our life. And unfamiliar doesn't mean that we don't expect bad climate. Let me try to illustrate this. If climate, using this line, if climate is this line, the middle is where we expect climate, the expected climate most of the time, and the ends are the extreme climates or rare events. If I could represent Caribbean life by a bell curve, it would be this. So we expect that Caribbean life will occur mostly around the climate that we have come to know for a long time. But and then we do plan for the extremer climate, but maybe they should happen once in our lifetime. Well, the truth is climate change is shifting where our life occurs. So much so that we are now straddling between a climate that we think we know and seeing more and more rare events. Climate is introducing this unfamiliar pattern, and we are just not used to it. So what happens when climate introduces this unfamiliar pattern? Well, what happens is that it renders our development pillars simply unreliable. Our development pillars cannot respond or cannot consistently deliver. I use, for example, the Agricultural Productivity Index from my own country, Jamaica, and it makes the point very clear. Every time agriculture wants to perform, climate is one of those factors that simply prevents it, whether drought or whether heavy rain. And so we get these kinds of headlines in our newspapers that drought hurts agriculture, but at the same time, rain mash up everything. But it's not just agriculture. We can extrapolate this really across all of the things we are depending on those development pillars for quality of life and standard of living. And so you see that tourism suffers as the beloved Jamaican beach is succumbing to climate change, or water, or this critical livelihood sector suffers due to floods or due to droughts. Or we see that biodiversity, the coral reefs are suffering, or the critical road infrastructure, and you get the idea. By introducing this unfamiliarity, our development pillars simply cannot perform consistently, and this therefore poses problem for the Caribbean region. I want to argue that this is true for health. I think this is a very familiar diagram for anybody in the health sector. And so I'm not a health specialist, but I do not want to spend time trying to convince you that climate impacts health. You know that climate impacts health, whether directly through the changes in vector ecology or allergens, or through the severe weather, or indirectly through its impact on the social determinants of health. So much so that the Lancet suggests that climate change is the biggest global health threat of the 21st century. Well, in much the same way that the other development pillars cannot consistently perform, I think this health sector in the Caribbean is challenged to ensure a healthy Caribbean now. Just trying to think it through a little bit. I can come up with a couple of reasons, and you can come up with several. Let me just highlight three. One, I don't think the health sector can consistently deliver because, in truth, climate-sensitive diseases and their associated models of healthcare are really patterned on an expected seasonality of occurrence. And I pull on the work of climate and dengue, where it shows that there's a clear climate seasonality to the dengue outbreaks, with a link both to rainfall and temperature. And then hence, when climate doesn't behave as it should, we get these kinds of headlines, that the dengue, climate change-driven dengue outbreak is the worst ever in the Caribbean. But I think you get the point that I'm trying to make. The health sector can't consistently deliver because some of the models of healthcare have this seasonality of occurrence, are patterned off of what we expect to occur. This would include, patterning deployment of resources, communications, but climate is throwing a spanner in that. But it's not only that, but clearly the other social determinants of health that were pictured in that diagram, the water quality, quantity, and availability, the quality and quantity of nutritious food supply, the clean air, those are also too climate sensitive. And so even if health could deliver, could manage the seasonality directly, or the seasonality impact on its sensitive disease, the other social determinants of climate in the Caribbean right now cannot consistently deliver. And that poses a challenge for the health sector. And then one more reason I would like to proffer. Climate change impacts people disproportionately, and the most vulnerable are the first and hardest hit. And so what you find is that when you have the climate varying in this unfamiliar way, it places a greater demand on the health sector by the most vulnerable, people like the elderly, the young, the chronically ill, and that kind of demand that it places, because the climate is not predictable, is not always predictable. Well, if our model of healthcare has a health pot that is fixed in terms of amount and proportioning, then when climate suddenly shifts, the percentage of the person or the share that a particular grouping needs to get, it causes a problem for the other persons who should benefit from that health pot. The health sector in an era of the unfamiliar climate is challenged right now to consistently deliver and ensure a healthy Caribbean. So the first thing I want to suggest to climate is simply saying, climate science is saying, when you don't scale it for the Caribbean region, when you downsize it for the Caribbean region, the first thing the science is saying, what should you do with respect to climate change? Acknowledge it as a present concern. Acknowledge the fact that there is already the emergence of an altered climate regime marked by the unfamiliar. And why should you do this? Because to do otherwise is to frustrate our regional development pursuits, including those of the health sector. Our development pillars simply cannot consistently deliver in the present regime of the unfamiliar if we do not acknowledge climate as a present concern. Very quickly, I said it was three simple things that the climate science is saying. So the first then is just acknowledge it, acknowledge climate change as a present concern, because to do otherwise is to frustrate our regional development pursuits. The development pillars can't consistently deliver. Well, the second thing that the climate science is saying is not just acknowledge it as a present concern, but secondly, contemplate it as a growing concern. What do I mean? I am putting again on the State of the Caribbean Climate Report, and it has things like, it is to be noted then that the projections suggest that as the century progresses, the Caribbean under the worst scenarios will be a significantly different place, not just a present concern, but a growing concern. Let me try to illustrate this a little bit from the science. So the science tells us that even hotter times are ahead, again, pulling on that work from the CIMH. Here is the present and projected heat impact potential from those hot days that I had shown earlier. The black shows the present, and you can see that it is increasing, the black line. And then when you take scenarios of the future, irrespective of the scenario you take, a best case scenario where global emissions go up and come down, or a worst business as usual scenario, those red and yellow lines all go quickly to 100% and stay there. What are we saying? even hotter times are ahead. The models that my group runs show 3 to 4 degrees warming in the Caribbean by century's end. Up to 98% of days will be hot by current standards by the 2090s, as illustrated in the diagram. And really only 2% of those days will be cool by the 2080s. The science is saying this is a continuing concern. Even hotter times are ahead. What does the science say about rainfall in the Caribbean region? Here I'm drawing on the recent IPCC report, which has this very telling diagram for the Caribbean region. And what it shows, again, very similar to that very first temperature diagram that I showed, that the brown in the middle of the diagram increases as we go to the right. And in going to the right is an increase in time, but as well an increase in global warming levels. And you will find that by the time we hit the highest global warming levels, the brown covers almost the full vertical extent. Well, the brown represents a decrease in rainfall, or a decrease in the monthly average of rainfall as you go into the future. So we never lose that variability. We'll still have that one year being very wet and another year being dry, but we now vary around a lower mean because our models show anywhere up to 40% drier in parts of the Caribbean region, a shorter rainy season and longer, more severe droughts. What else does the science suggest? How does it illustrate climate as a growing concern? Yes, even hotter times. Yes, even drier times, but yes to even higher sea levels. Remember those 3.5 millimeters per year we already see? Well, the work by Nurse et al. Shows that across the Caribbean region, the projections represented by the red bars for each slice under the worst case scenario, the red bars represent the worst case scenarios, can approach up to 1 meter by century's end. Now we compare that to the millimeters before. And with that higher sea level, of course, becomes increased inundation when coupled with storm surges and waves, and of course, enhanced shoreline retreat. Again, from the most recent IPCC report. And what about those extremes? Even more intense extremes. So work in the region shows that if you take the percent of time that the Caribbean is under moderate, extreme, or severe drought, you can see the increase as you go throughout the century, from 17% all the way through 34%. And those storms, those tropical storms, higher rainfall rates and stronger winds suggest the IPCC reports. What are we simply saying? The science is telling us, sending us a message. If you look on the Caribbean and you look at what we have already seen and compare it to what is likely to come if we do nothing about climate change, compare the temperatures 1 to up to 4 degrees and year-round warm. Compare the rainfall, variable, but variable now and up to 40% drier. Compare the extremes, we're having more extremes now, more intense extremes, and compare the sea level rise, that 3.5 millimeter per year to up to 1 meter sea level rise. The important thing here is that the science is saying we are looking on the possible future entrenchment of a climate regime marked by changes outside the bounds of our present lived experience or within the realm of the unprecedented. We are looking on a future Caribbean where the climate is a climate we have not lived through as yet. So we must contemplate climate as a growing concern. But why then? So why should we contemplate climate as a growing concern? Or how do we illustrate this idea? Remember my diagram, and I indicated that we are living straddling a climate we expect to happen and a climate of rare events, which is happening more. Well, in truth, if we do nothing about climate change, we push that where we live a little further to the right. And we live now more in the extreme rare events and even in a climate we have not seen as yet. So what's so important about contemplating it as a growing concern? The truth is we do have an insight into what unprecedented climate is like. If I use tropical storms and hurricanes, then 2017 was an unprecedented year. We had 3 Category 5 hurricanes going through the Caribbean. Remember that Irma, Maria, and Jose. If we take then 2019, we had Dorian, and we know the unprecedented nature there. And if we take 2020, when we exhausted the alphabet, we can also see the unprecedented climate there. So we have an inkling of what unprecedented climate might look like. And we do know that unprecedented climate equals unprecedented impacts. It's life in its totality in the Caribbean that's impacted. Let me push this a little bit further. The truth is, as a Caribbean region, we have advocated for 1.5 to stay alive. And what does this mean? That as the world warms, it should warm no more than 1.5 degrees by the end of this century compared to pre-industrial times. And we have so advocated for this that it's represented in the Paris Agreement. The Paris Agreement speaks to pursuing efforts to limit the temperature increase to 1.5 degrees. Well, in a science project that we did, or well, a science collaborative effort that we took on in the Caribbean, we tried to look on what would 1.5 degrees warming look like for the Caribbean. And the truth is, even at 1.5 degrees, it is not safe for the Caribbean. We border on the unprecedented. And due to the scientific work of several scientists across the Caribbean, we can talk about 40% less hydropower in Suriname. We can talk about diminished agricultural productivity in Jamaica. We can talk about 2 to 3 times higher the cost of in the region with respect to damages. We can talk about median aridity of 4%, and we can show the inundation across airports and seaports or coastal infrastructure in St. Lucia and Jamaica. So even at the 1.5 degrees, which the Caribbean has adopted as its position, we border on the unprecedented. The truth is, what I'm saying is this. The climate is a growing concern because those sustainable goals that we are going after, sustainable development goals that we are going after, every single one of them is threatened by climate. There will likely be significant impact on all of the things that determine quality of life and standard of living. And you see it, you see the impact on the poverty or the zero hunger or the clean air and sanitation and the water. And we see it. It is likely also that the good health and well-being that is the goal of the health sector will also be threatened. Let me just round this up by saying, why do I think the health sector's goal will be challenged? Well, I think the health sector will be challenged to deliver a healthy future Caribbean. Because one, the projected shocks to the health sector, both the frequency and magnitude from the changes in climate, will also potentially be significant and sometimes outside the bounds of our lived experience to date. So I pull on that IPCC 1.5 report to say, even at 1.5 degrees, look, there'll be compromised safe work activity and worker productivity. There'll be deadly heat waves in cities, including in the Caribbean, and the millions exposed to heat will increase. The change in the geographic range of the vectors, the decrease in nutritional equality of the important crop foods, and the global undernourished will increase. So in an unprecedented era, even the things that the shocks will be there also to the health sector, and they will be such that it puts sometimes what the health sector will have to deal with outside the bounds of our lived experience to date. But that's not the only reason. One of the things moving to an unprecedented climate will be a significant expansion of the most vulnerable and the emergence of the new class of vulnerable. So we will expand the number of people who are vulnerable to climate change, those who will be faced by increased forest fires and have to deal with those effects, those who will be in the path of that inundation. So people who are already vulnerable those numbers will increase. But there will also be the emergence of new classes of vulnerable, or the new classes of climate vulnerable. For me, we must pay attention to the outdoor workers in the Caribbean. Caribbean work life is in a large part an outdoor work life, and they become more vulnerable in unprecedented temperatures. Our athletes and our sports officials become among the new class of vulnerables. Our healthcare professionals in terms of mental health and having to deal with repeated and increasing climate-related devastation or impacts on people. And it doesn't only have to be people. We can talk about biodiversity that is already not that impacted, that will be impacted. And then even our healthcare facilities. The map of Jamaican hospitals and health centers show that they dot the coast. They become among the new emergent new class of vulnerable. So the health sector is going to be challenged to deliver a healthy future if we move into the regime of the unprecedented. And then just one more reason, there will be dramatic increases in the cost to deliver healthcare in an era of unprecedented climate. Of course, we don't need to dwell on this. There'll be increases in the demands for energy for cooling and the attendant costs for water, and of course, resilient infrastructures for retrofitting or building new resilient infrastructure. So the point that I'm making is that we must contemplate climate as a growing concern. That's what the science tells us. And we must do so because the health sector will be challenged to deliver its goal of a healthy future Caribbean. So let me sum up that quickly. What is the climate science telling us? Climate science is telling us this. What must we do about climate? Well, first, we just must acknowledge it as a present concern. Otherwise, we frustrate our regional development pursuits because our development pillars can't consistently deliver. But it's also telling us that we have to contemplate climate as a growing concern. The possible future entrenchment of a climate regime marked by the unprecedented. To do otherwise is to forego our regional development plans. Those plans that we are reaching for will be either deferred or delayed, and those include health. Let me quickly round this off, Ben. The climate science tells us one other simple message, not just that we must acknowledge climate change as a present concern, and not just that we must contemplate climate change as a growing concern, but lastly, that we have to tackle climate change as an urgent concern. Certainly, if you are in the opening ceremony, you heard it. But the State of the Caribbean Climate says, given recent experiences and future projections, it seems clear that the Caribbean can no longer afford the cost of the catastrophic consequences of climate change, nor can it afford not to respond to climate change. How then do we tackle this climate? I would argue in a couple of ways. One, as a region, we have to join in the pursuit of a strong mitigation agenda. So the truth is, the top diagram shows the fact that if we look on global climate emissions, the only way that we can hit 2 degrees or 1.5 degrees is if those global emissions taper off very soon, certainly before 2030, and sometime in the future cross the zero line. The IPCC special report on 1.5 degrees puts some numbers to this. It says, if we are going to achieve 1.5 degrees with no or limited overshoot meaning we hit it, we go above it and then come back and achieve 1.5 degrees as a goal for this century, then carbon dioxide emissions have to decline by about 45% from 2010 levels by 2030 and reach net zero around 2050. So pursuit of a strong mitigation agenda globally has to be the target, and certainly within the Caribbean. For the Caribbean, that means for us, we have to look on these 5 things: energy, waste, how we treat our blue and green forests, oceans and land, and transportation. And indeed, cutting emissions in all of these areas are not only good for the global agenda with respect to where we reach in terms of global warming, but are win-win for the Caribbean region. Can I just throw out in passing that the health sector has a role in mitigation? And so the health sector has to come quickly to terms as well with how it contributes to greenhouse gas emissions and what is its potential significant role in the mitigation agenda. Look on the energy used, the waste and what happens to it, and transportation. Based on whether you use a decentralized or centralized models of health or and the role that e-health has to play. The health sector has a role to play in the Caribbean's pursuit of a strong mitigation agenda. Just in passing, let me say that mitigation in the Caribbean needs a champion. Very often we speak only of adaptation, which you will hear me talk about next. And mitigation needs a champion in the Caribbean. And strangely enough, I think the health sector should quickly come to terms with its potential significant role as a mitigation champion. I think the Lancet said it really well. The health co-benefits associated with emissions reduction strategies offer extraordinary value for money. The financial savings associated with avoiding ill health and productivity gains can outstrip the cost of implementing emissions reduction strategies if they are carefully designed. Health sector can lead us as the champion for the mitigation agenda. But it is not only a strong mitigation agenda that we must pursue, it has to be an unavoidable adaptation agenda. And I said it, even if we achieve the 1.5 degrees that the Caribbean advocates, it's not a safe climate. And so we'll have to adapt to the impacts of 1.5 degrees. And those adaptations that adaptation will have to be across all areas of Caribbean life. What does that mean? It means that the health sector must be at the table when all these areas of Caribbean life are crafting the adaptation plans, because those other areas are also co-determinants of health. But it also means that the health sector should have its own adaptation plans. And it is heartening to see the range of plans that are emerging in the Caribbean region. What we now need to do is move from plans to policy to practice. But the health sector plans, I don't need to name them. That's what you'll explore in this conference. You know, they must represent vigilance and monitoring and responsiveness of the health sector, whether they mean, you know, closely monitoring the margins of current geographical distributions of disease or mapping vulnerable communities. Those plans must have vision and boldness. They must target 100% climate resilient health infrastructure. Certainly the decentralization of delivery of some aspects of health, and you know the various plans, and clearly they must reflect that the health center is very vocal and bought in. Climate health focal points at all levels to review and interface with other sectors. We have to pursue an unavoidable adaptation agenda in the Caribbean. We have to pursue a comprehensive scaled-up research agenda. I am looking forward for what will come out of this conference. Certainly that research has to, and an important thing for us in the Caribbean is that that comprehensive scale-up research agenda must have the Caribbean at the center. So we have to research the mitigation and adaptation for the Caribbean health sector, look on priorities, co-benefits, trade-offs. What are the models of leadership and governance from national to regional? Where's the role of private and public sector and finance? What about those climate resilient health systems? Do we really need to rethink sustainable technologies and infrastructure? How do we integrate early warning, risk monitoring, and emergency preparedness and management? What about innovation and new technology for the Caribbean reality? And yes, though research is done on the climate impact on Caribbean health, are we accounting for the differences or the inhomogeneity across the region due to differences in physical, socioeconomic, and cultural realities? A comprehensive scale-up research agenda has to be a part of our tackling. And then, of course, a structured education agenda. That's this conference. And we need a structured education agenda at the regional and national levels. And then lastly, just pursuing a deliberately collaborative agenda. The truth is, climate change's challenges dwarf the limited human, financial, and technical resources of any single Caribbean country. Hello?
I need you to wind up, sorry.
I'm finishing.
Okay.
It dwarfs all the resources of a Caribbean country. And so we need to work together across academia, government, private sector, community, and civil society. It's when we put all of this together that we get resilience. So let me just finish then. What does the climate science say? Well, it certainly says that we have to acknowledge climate change as a present concern. To do otherwise is to frustrate our regional development pursuits. It certainly says we have to contemplate climate change as a growing concern. To do otherwise is to forego our regional development plans. But it certainly says we have to tackle climate change as an urgent concern, respond to climate's demand for a new era marked by urgency. If we do so, then we can fulfill our regional development potential. And isn't that the goal? To move from frustrated development pursuits to fulfill development potential? Climate science says what we must do: simply act, acknowledge it, contemplate it, and tackle it. Thank you, and I'm sorry to have gone a little bit over the time.
Thank you very much. Thank you very much. I'm sure everyone who is listening to this must be as moved as I am to hear the climate science unpacked for the Caribbean. You see why 5 years ago, the presentation of this work stimulated us to form Arithmetic. Now, there are a number of questions, but we only have about 5 minutes left. I heard we need to talk about this more. I heard we need to get our act together in the Caribbean, but we need to make noise at the global level like we never have before, because that's where we solve the problem. Michael, there were several questions. I don't know if you saw any of them. What are some of the technologies that can be deployed to help us adapt? Will sea level rise occur evenly around the region? Were two that popped into my head. You're muted, Michael.
Sorry about that. Right. I'm sorry, I didn't see all of the questions, but let me tackle the last one first. Sea level rise is an issue across the Caribbean region. Clearly, there are a number of the determining factors that determine whether shoreline will be taken away. But if right across the region, there is generally in the mean, about the same amount of sea level rise. But when you go down to the sub-regional level and certainly to the sub-country level now, if I take for Jamaica, the impact of that sea level rise is more on the south coast because of the geography and the bathymetry of the south coast versus the north coast. But sea level rise is impacting all of the Caribbean right across the region. New technologies, yes, new technologies. There are new technologies that can certainly help us. Certainly, if we're looking, for example, the renewable energy space, the renewable energy technologies that are coming on stream have the potential to transform where we think we need to get our energy from, and whether the Caribbean can move towards greater percentages, even 100% renewable energy, and that has direct impact for resilient health infrastructures and the ability for them to come back up after a severe event. My only caveat is, in the Caribbean as well, we need to begin to think about technological solutions that are context driven, and very often, what we do is import the technology, but that's where the research comes in, and the pursuit of research.
How does the ordinary man on the street get this issue into every major government policy?
One of the things, scientists are never very good at talking climate change. They say we talk it in such a high, language. But when we begin to make the man on the street realize that they are living climate change right now, then I think it becomes a matter of urgency. So you see that electricity bill that you get at the end of the month, right now it's already impacted by climate change. The greater amounts that you spend now in the warmer months versus the previous months, or if you look on that comparison. The cost of your food items when you go are already impacted by climate change, because when climate change destroys the agriculture industry and food items are all imported, that cost you are already bearing climate change. The nutritional quality and the diseases you suffer are you're already living climate change. So somehow if we break climate change down into the fact of the everyday existence, whether you have water in your pipe this morning, or whether you have a challenge and you have to deal with catching and storing water and therefore your day, if we can break climate change down so that people can see that they are already living it, it's impacting standards of living and quality of living, then we know that we can get a mass, the people will ensure that climate reaches into government policy, not for tomorrow, but for today.
Thank you very much, Michael. It's at 1:50, then we're closing off. We will try to answer some of the questions that came in the chat separately for the participants. I was entranced by what you said, and I could have listened to you for another hour, but we've run out of time. So ladies and gentlemen, thank you very, very much for attending this keynote address by Professor Michael Taylor from UWI Mona, Jamaica. Again, stay with us for the rest of the day as we deep dive now into some of the impacts and unpack that in more detail.
Thank you very much.